Right there. Hello, everybody. This is Amy Regester, hanging out with my mom, the Home Health Mentor at thehomehealthmentor.com. Yes, that's right. We do have our new website up, and it's being populated with a variety of products and like policy and procedure type stuff, and even some kits that my mom's designing to help new home health administrators get on their feet, learn some stuff. So you might want to check it out. It's probably not quite ready for you to purchase yet, but it will be. There are some things there, and it will be ready and added to over the next few weeks, and I'm sure continuously. But we just wanted to let you know it is coming, and we would love to have you take a peek at it. Today, our topic is about problem solving. And last week, we talked about how an agency admin could use Casper reports or any kind of internal reports to identify their agency's problem areas. And this is kind of part two of that. Moving on, what do you do when you find problems and how difficult it is? Mama, you were talking a little bit about this before we went live, and how difficult problem solving is, how it makes people feel pretty rotten sometimes. Talk a little bit more about the complexity there.
Yeah, the whole idea of running an organization of any kind is making sure that the quality of whatever you're doing is top notch. And so talking about, being your own consultant or finding your own problems and fixing them, doing your own mock survey, all of those boil down to how do you measure the quality of the services that you're providing. And we talked last week about Casper reports being good tools to help you focus on some of those problems and to try to fix them. The problem with problem solving is that sometimes it gets, or at some point in the process, it can get very personal. I always go into the process knowing that there are some critical places in the process where there can be finger pointing, there can be people whose feelings get hurt. You can get teams, fighting against each other, saying it's not our fault, it's this department that's got the problem. So at some point, you have to sometimes deal with those kinds of issues that you might not have really even planned on. They might be really part of the bigger problem, that you don't have good cooperation between the people who work in the organization. So yeah, the steps are easy, but going through the process really can be very complex and intimidating.
I think you brought something to light just now that it's not, this is, off script, but kind of what you're talking about for these new admins is like dividing up what is interpersonal and dividing up what is the technical problem is probably, part of their first step, and part of their greatest job is always managing the humans that we're working with. It's like a big family. Can turn into family food really fast. So you have kind of broken down some stuff to help people keep on task on the technical side. The human relations side, man, that's going to take a tender touch. But tell us a little bit about this process for going through and just really figuring out where this big ball of mess is.
Well, let me start out by trying to make a clarification statement. The kind of problems that I wanted to talk about today are not the kind of everyday fires that pop up that administrators have to take care of. It's not the kind of problem like the copier is jammed, or the nurse that was supposed to take call tonight is sick, we have to find a replacement. What we're talking about are the more complex problems that show up in those CASPER reports or in your internal reports that let you know that patient care as a whole is not happening the way you want it to. So again, I want to digress just a minute and say that in January of 2018, something major changed, and one of the things that you'll see in, can you hear me?
Yep.
Oh, okay, I was hearing some other noise, and I wasn't sure if I left you. So yeah, something major changed in January 2018 with regard to taking responsibility for quality assurance and process improvement. CMS decided that what they had in place before that time wasn't working, and what had been in place was a professional advisory committee that was supposed to be participating in the quality assurance process. But what they found is that the board of directors in many agencies wasn't involved in the process at all. And they didn't know what was going on in their agency. And a lot of agencies were just pulling in bodies to participate in the professional advisory committee, and they weren't really doing what they were supposed to be doing. So CMS said, okay, we're going to make the board of directors primary responsible for the quality of services. Legally, they were already responsible, but CMS said it's time for members on the board of directors to actually get involved and know what's going on. So that changed. And what also changed was if agencies were cited on quality issues, the fines and the penalties went way up. And I thought of one agency that I know of that had let their physical therapy department or their contractors kind of go by the wayside, and they didn't have enough therapists to take care of the patients. So when they were surveyed, they were cited $6,000 a day until they fixed the problem. And so obviously, those fines can add up really quickly. And if the board had taken responsibility and provided the resources for them to hire who they needed to, that, they could have saved themselves a lot of money. So the board is the primary part of the organization that needs to take responsibility for quality. And new administrators tend to, at least I guess I'm speaking from experience, we tend to be intimidated by board members. We sometimes think we can't ask for what we need. And sometimes we don't know how to quantify what we need. But it's really important to get past that and to be able to go to the board and say, these are our quality issues. Here's the evidence of that. And this is my proposal for how to fix the problem.
So this is like,
go ahead.
A little flexible.
I didn't hear you.
I think I've got a little feedback here. So what you're saying is, like, this is such a big deal that knowing who is involved in this is going to put you as a new home health administrator, knowing who you can go to with power and authority and say, here is what I need from you. That's going to help them feel like they can approach their board with that authority.
Yes. And if the board doesn't give you, as an administrator or a director, if they don't give you the tools or the respect or the authority to do your job, then you're probably in the wrong place. And, it would be a losing battle. You'd just keep fighting that day after day. And
Yeah. If that's you and you're listening right now, please drop us a comment. We will create for you an exit strategy in our next podcast. All right. So,
and if you're a board member, take note as well that you
yeah,
need to choose
be
people
proactive.
that you trust and then let them do their job. Give them what they need to get it done.
All right. Getting into the meat of this presentation, let's say somebody's identified the area of concern from their reports, whatever, and now they're on to finding out the root of the problem and solving it. What are these 8 steps that we've talked about that is going to get them from confused finger pointing and throwing their hands up in the air to a stable plan of action?
Okay, so step number 1 is to choose a good team of individuals that you believe will help define the problem accurately and will not get personal. So that's number 1. Choose a good team to work with. And
right.
that group's going to be your quality assurance / problem improvement committee. In the industry, it's just called QAPI, but it's your quality assurance problem improvement committee. Step 2, you want that group to have the time and the resources to get together in person to define and quantify the problem. And again, as an administrator, you're going to provide them with that information. You're going to give them the data. You're going to show them the reports. Hopefully, you will have someone in that group who can look at data and figure out what the problems are and problem areas, that they can address. And a common approach to problem solving is called a root cause analysis. So it would be good if someone in that group, whoever's chairing it, understands that process. It's pretty much what you would think it is from the name. You want to dig deep into the issue before coming up with your plan of action. You want the members of that committee to be able to objectively look at influencing factors that are causing the problem or feeding into it.
Okay, so to make a cross application for something I understand, this is like when the teacher is trying to figure out why the student's not doing well at school, they're going back and they're tracing it back as far as they can. Is this why you're not doing your homework? You're not doing your homework because you're too sleepy, and you're too sleepy because all these other things are going on, and your family's so busy, and so you're collecting all the bits of information that would influence it.
Yes. So there's different ways that people have come up with diagramming the process. But the main point is whatever, diagramming system you use or concepts you use to go through the process, the main part of this is to find the threads and backtrack and figure out what leads up to the problem. So step number 3 is to build a sequence of events that seem to precede the symptoms of the problem. And then you can diagram out or write out steps that as a group you think is contributing factors. Okay. So I wanted to share a quick story from my early years. I remember we had a number of issues with our admission process, and I was a fairly new administrator, and I didn't understand all the steps, that our people went through when we were admitting a patient. So I was looking for a way to diagram that out, and my best thought at the time was to I was in one of the big box stores and saw a roll of meat packing paper. And I said, I bet I could draw out our sequence of events on this paper and put it up in our conference room and then ask people to fill it in. What happens first, what happens second, and so on. And we found a lot in that process. And of course, the meatpacking paper was great because it just went on and on. It was a big roll, and we could add to it, and we could carry it out as much as possible. Yeah. And so it was, kind of one of those down-home solutions, but it worked. And we kept that up in our conference room for quite a while, and we used it to orient our staff as well, so they understood the process. So there's different ways. I just tell the story because, be practical about your problem solving. You don't have to, just worry about using the right language or the right diagram or the right tool. It's really a process of going through a logical succession of processes.
Yeah, the only problem with the meatpacking paper is that people who are interested in getting a flank steak were hungry all day.
I don't think they realized what it was.
No, I like it because, we've got tons of technology, but that made it a together experience as well. So you're getting some of that human relations side in, and
right.
Getting people to participate is sometimes like getting that buy-in is so important, and being able to see it all at once.
And no names were allowed, on this diagram. We didn't put people's names on there and say, this person.
It's you, Karen. Karen dropped the ball.
Right. Yeah. It was strictly processes. So it kept all the personal elements out and just went step by step. This is what happens or is supposed to happen. And it helped us really understand where pieces of paper were going or information was going as the process continued. So step 3, build the sequence of events that seem to precede the symptoms of the problem.
All right.
And then step 4, identify as many contributing factors as you can and do it from various perspectives. And, that's why you have a team. It's not, I think that this is what the problem is. It's, you you draw out from people, from their perspective, what is, what they're dealing with. A lot of times there are things happening that you don't understand, and you don't understand what the impact would be if you change one thing in this, sequence of events. You're going to negatively impact somebody else. So that's why you have a team, so you can get all perspectives on the issue, and everyone understands then, we may gain here, we may lose over here. What's our best approach to solving this problem when you consider all the issues? So, look at as many of the contributing factors as possible and do it from the various perspectives. This is the part where it could get very personal. This is the place where people tend to want to hide their own problems. And a lot of times they know what they are. They want to hide their problems, and they want to point a finger, at another department, or, make comments about a certain person. And this is where you want someone who is really skilled to be able to rephrase things to keep it positive and moving in the direction of a problem-solving process, not a personal bashing situation.
I want to pipe up here and say it's absolutely true that people are problems, and that you might run into people who just don't have their stuff together, and we can offer grace and mercy and know that, their life is really whatever it is right now. They could be going through a tough spot, and it's an opportunity for the team to rally. But if this is exposing, somebody who continuously drops the ball, then don't worry about it right now. But like you were saying, just rephrase it. So like, here's what we need at this spot, for this to go smoothly. Don't even think about that person or what you're going to do with them then, but just keep stating in the positive what you do need here. And that can take the focus off.
Yeah. And as a chairperson of this committee, it's important that you model that culture, that you start out by saying, we are going to get down to some nitty gritty. I just want you all to know, no one is perfect. We're not going to criticize people. We're going to look at the processes. And if someone feels they need more education, we're going to support you. We're going to take care of it. So, don't worry about losing your job. We're going to fix this, and we're going to do it together. So if you take that approach, it's a lot less threatening, a lot less intimidating, and just focus on the positive and try to bring everyone else back to a positive if they get off track.
Awesome. All right. I just want to welcome people who have joined us and are listening, and thank you so much for being with us. If you've got any questions, get them ready because we're kind of coming into the last few minutes here. All right, go ahead, Mama.
Okay, so step 5. So once your coffee committee has unraveled a problem, then you're moving on to some potential solutions. And it's important to keep in mind there's almost never one way to fix a problem, and there's rarely just one step in the process. And rarely can you change one thing without changing a multiple of other things. So this is the point at which you're going to answer questions like who, what, where, when, and why. So, and some people talk about the why part of this going 5 deep. So why is this happening? Why is that happening? Why is, the next thing happening in the sequence of events? So step 5 is time to look at potential solutions and say, we can fix this way. We could fix it this way. If we do it this way, who will take responsibility? What are we asking them to do? What are the details? You have to break it down and actually start, realizing you're going to have to assign people the resources to take care of the problem. And then step 6 is where you implement the plan of correction. Once the group has kind of decided, okay, this is the path that we think is the best one to try to approach this problem and to fix it, then you're going to get into implementing that plan. And then if the problem was identified by some kind of a report, then you're going to say, how are we going to know that this problem is improving? What are the indicators that you're going to be looking at to make sure that you even know if you're fixing it? And then step 7 is to analyze your ongoing data and continue to monitor the processes and tweaking them, or refining is probably a better word, but you may find that in the process you come up with little things that you didn't think of the first time around that could make a difference. So you tweak it and you continue to monitor the process. And then you obviously are going to document all that. As a committee, you're going to look at those processes. You're going to say, is this working? Is it not working? if it's not working, how can we refine the process? And then you implement those changes and continue to monitor to see if you can fix it. And then step 8, which is kind of back to where we started, you're going to report all of these activities and processes to the agency's board of directors. It's ideal if one or more of the board members actually sit on your QAPI committee, so they hear the data firsthand, they get to know the kind of processes the committee goes through, and they can go into a board meeting and give some support to the recommendations. But if that is not the case, then at least they have to have the data in front of them, and you as an administrator have to insist on having some time in every board meeting to present the quality outcome information and to give reports on the Quality Assurance Committee's activities. That's an absolute must, not just for the sake of the organization, but a surveyor is going to look at those board meeting minutes for evidence that the board has been advised of quality issues and look for their response. And if it's not appropriate, that's very likely going to come through as a citation of some kind. So those are the 8 steps.
Yeah, just as simple as that. Because you attended this Q&A, you'll probably never have problems again.
That's right. Sure enough, you'll just know automatically how to fix everything, and you'll just be a pro at making sure everybody stays civil.
Yeah. Well, thank you so much, Teresa, the home health mentor. Do you know what you're going to address next week or next time?
Not exactly, but my plan has been to break down the conditions of participation into the parts of an audit that an agency would want to do on its own. So there's 14 COPs. So what I've done personally for the agency that I work with is I've taken each one of those conditions, I've broken them down into level 1 and level 2 standards, and then developed an audit tool on Excel where I can not have to do a whole audit all at once. I can actually do an audit on each of the conditions. And then I focus on the level 1 and 2 standards.
I think we'll make that available on the website pretty shortly too, right?
Yes.
All right.
So that's kind of the process that I'm thinking I'm going to do going forward, unless there are people who, specifically request some other topic. But
burning questions.
Yeah, but that's what I hope to do, and I'll usually start with some of the content that is, the easiest to look at.
All right. Well, that's about it for us today. I don't see any questions in the chat, but just wanted to thank you guys again for being with us. It's always the goal to educate and to inspire, to have a good time, and really just to let you guys know there is somebody here for you who wants to take your questions and address them. And while we are starting this project off, you definitely have the ability to influence the direction we go in the Q&As. So don't be shy. And if it's really sticky and personal and, all that kind of thing, you don't have to put names or details, but, not that we wouldn't mind your gossip. You can lay it on us. Hi, Jennifer. Thank you for joining us today. But yeah, let us know, and keep the website in mind, thehomehealthmentor.com. And if you want to be notified of when we go live, you can hit the star or the bell, whether you're on Facebook or YouTube. And we are planning to do this every Friday that we can. And so we'd love to have your questions, and hit my mama up on facebook.com/thehomehealthmentor for questions to be considered for future podcasties. Thank you so much, and we'll see you next week.
Bye.
Bye, Ricky. Thank you so much for joining us, and we'll see you soon. Bye for now.
Bye.